Well, good afternoon, and thank you for joining us today for today's webinar, Impacts of Reducing Federal Research Funding. My name is Lisa Lewis, and I'm the President and CEO of the University of Minnesota Alumni Association. Before I turn things over to our esteemed presenter, I have a couple of announcements. First, the Alumni Association is proud to help bring the university expertise to current events to the alumni community. Timely programs like this are made possible by our Alumni Association members. So if you are joining today's webinar as a member, we thank you for your support. And if you're interested in learning more about membership and joining us, we invite you to check us out on our website at umnalumni.org. Second, questions throughout the webinar are welcome, and you can submit them anytime using the Q&A feature found on your Zoom toolbar. We have set time aside at the end of Dr. Crawford's presentation for Q&A. And without further ado, I am pleased to introduce today's presenter, Dr. Peter Crawford, who is Vice Dean for Research with the University of Minnesota's Medical School. He's going to share more about his background and dive into today's topic on federal research funding. Please join me in welcoming Dr. Peter Crawford.
Thank you so much, Lisa. Thank you for the opportunity to meet with all of you today. This is a privilege to have an opportunity to engage with the Alumni Association at the University of Minnesota. My name is Peter Crawford. As Lisa said, I do serve as Vice Dean for Research for the University of Minnesota Medical School. I'm a physician scientist. I'm trained as an adult cardiologist. I'm an investigator. I have a laboratory-based research program that is dedicated towards understanding the metabolic origins of disease, of the complications of obesity and cardiovascular outcomes. I have an active training program. I'm committed fervently to the development of the workforce in the next generation. This is a significant passion of mine. In addition, I have the privilege of serving as the Deputy Director of our Clinical Translational Science Institute. This is an institute that is supported in significant part by a large grant from the National Institutes of Health, from the National Center for the Advancement of Translational Science. This is a significant infrastructure that underpins our clinical research engagement and our community engagement at the University of Minnesota. So yeah, thank you for advancing to the next slide. What I'd like to do before I provide some contextualizing comments around the importance of federally funded research, I'd first like to just give a little bit of content with respect to the impact that your university is having with respect to National Institutes of Health funding, which is our predominant funder from the federal government, particularly from the Health and Human Services branch. So we are fortunate to have an incredible cohort of faculty, staff professionals, and learners who have positioned us to be in the top 25 universities of over 200 that are ranked nationally by the Blue Ridge Institute for Medical Research. We are ranked in the top 25, and we've actually been there for the past few years due to the incredibly devoted commitment of our teams. So what this means is this reflects that the University of Minnesota Medical School has been able to recover $291 million in total awards for the fiscal year 2024. This has also put us at number 11 among public institutions in the United States as well. This is a bit of a lagging index of the impact and the productivity of our investigators. Grant awards are typically awarded for programs that are already successful, that are making a difference in people's lives, that are developing the next generation of scholars and learners, that are directly delivering solutions to patients in the near term, and developing the paths that are going to be the next standards of care in the future. So the Blue Ridge Institute is a group that collects the funding data, curates it, and puts these rankings together annually, and the rankings come out every February. Next slide, please. The University of Minnesota in toto is also ranked in the top 25 nationally, and that is through its recovery of $380 million. So apologize for the typographical error. So we're 25th for both the medical school and nationally. So the medical school has recovered $291 million, and the University of Minnesota in the aggregate has recovered $380 million in National Institutes of Health funding. I'd like to call out a couple of our highly successful programs, including our family medicine program, which is actually ranked #1 in the United States by a very large margin. So our family medicine program has recovered $24 million in fiscal year 24 in NIH funding. And it is #1, our family medicine program, by a $15 million margin over #2, which is really remarkable. And in fact, 5 of our departments in the medical school, spanning, as I mentioned, primary care, but also into our surgical subspecialty and pediatrics as well. And our basic sciences are also represented in the top 10 for their departmental categorizations nationally. So we have some very high performers at the University of Minnesota as well. I'd also like to call out that in the aggregate, Minnesota, the state of Minnesota, is ranked #12 in funding per capita nationally and #2 in the Midwest. So Minnesota, as a whole, is very successful as well. Next slide, please. So what does that mean for the state of Minnesota? $715 million were recovered in National Institutes of Health funding in fiscal year 24. This turns into, for every dollar of National Institutes of Health funding, $2.46 of economic activity that is stimulated. So that's reflected in the $1.76 billion. And funding through the National Institutes of Health also supports over 7,700 jobs in the state of Minnesota. This is quite impactful. And I'd like to contextualize this to the life sciences industry in the state of Minnesota, which includes over 7,400 businesses, over 300,000 employees, and stimulates over 10% or $48 billion to the state's gross domestic product. So it's really important, and one thing that I'd like to do is place in context the role of federally sponsored research in stimulating economic activity, supporting jobs, supporting workforce development, and as well as, and while in fact, the new therapies and cures and treatments are being developed. Next slide, please. So a representation of this is on this slide here, which quantifies the number of medical school derived studies that are identified as clinical trials. So almost 1,000 that are in various stages of progression at the University of Minnesota Medical School, with over 60,000 potential enrollees, those that are planned for enrollment or who have been enrolled. Almost 250 of these studies are designated as NIH-sponsored clinical trials with up to 1,700, over 1,700 enrollees. So this is just one representation of the impact through the clinical trial perspective, which is a very important component of what the National Institutes of Health funds. I'd also like to contextualize on the next slide where the United States is placed among our peers and friendly competitors and partners in the world. And what this slide reflects is the investment of various either nationally based funding agencies or foundation-based funding agencies in their ranking in the world. And this was just published in the last couple of weeks in the journal Nature. You can see where the National Institutes of Health has stood. This is a remarkable reflection of the investment of the United States in this critical infrastructure, and we're very much a world leader in this regard. If you look at this at a per capita level, we're still far ahead of our friends and competitors around the world. Per capita, we're at over $100 per individual. Other countries are closer to $20 per individual that's invested in biomedical research enterprises. So the United States has been a national leader, and obviously this has significant implications and really underpins what I describe as a bond of trust that certainly starts with our citizens, extends through the federal government, connects us to our health systems, like our medical centers, like that which we have here at the University of Minnesota Medical Center, extends into our private foundations, of which that number 2, the Wellcome Trust, is one of those. And also, very importantly, connects to our for-profit private sector. So we're all interconnected in this bond of trust that is committed to improving human health, improving the human condition, to workforce development, and then ultimately a key component of it is our national security that's supported in this process as well. So when we think about these components, our citizens, the federal government, our health systems, private foundations, and the for-profit private sector, we think of the impact through clinical trials, through workforce development, through current jobs, our national competitive edge, and of course, national security. So if you go to the next slide, I'd love to spend a couple of minutes, and I thank you for the opportunity to share with you the construct of facilities and administration costs, or F&A. This is something that has been brought up recently because the NIH on February 7th announced that it would like to reduce the facilities administration cost capability of all institutions to 15%. So this is now under a preliminary injunction, so this is not taken effect, but it does provide us an opportunity to reveal what this means, what facilities and administration costs cover. So the facilities component can include elements like the infrastructure, the buildings that we have, the laboratories that serve as the place where discoveries are made, our data storage solution, our servers, for example, our utilities, our HVAC, our plumbing, our electric, of course, our safety practices, and the elements that are in place that ensure that our employees and our patients, the participants that so willingly and graciously participate in clinical trials, our learners are afforded. Our hazardous waste disposal, these kinds of elemental components that are required to do what we do. The administrative piece, of course, these are the human beings, the talented individuals that oversee the compliance activities, ensuring that we will meet federal, state, and local regulations and law. Our payroll and accounting leaders and very important talented individuals in those domains. And if we go to the next slide, you can just kind of see what this looks like at the University of Minnesota and how this is so important. So a couple of points that I'd like to work through is sort of kind of getting inside the numbers, if you will, for a moment. It's important to underscore that all of the facilities and administration costs that are recovered, source the research that is primarily budgeted through the grants that are requested, that are competitively funded through the National Institutes of Health. It's also important to underscore that many of these infrastructural elements and these talented individuals will be working on multiple projects, but it's the facilities administration costs in the aggregate that are important to underpin the activity. Federal research grants provide funding for F&A to help reimburse universities, which have already spent these costs. So that's another important piece of it. Metaphors that are useful, I think we can think of it as the road that we're driving on, or that critical weight supporting infrastructure for the building that we're in. It's absolutely essential for us to be able to do this work and to be able to extend our findings into the next phase. The other thing that I'd like to mention is what the percentages mean. So at the University of Minnesota, that a currently negotiated rate is 54% for facilities administration. But I'd like to contextualize exactly what that means. So what that means is that for every dollar that's awarded by a grant from the National Institutes of Health, an additional 54 cents for that grant that is awarded at the rate of 54%, an additional 54 cents is awarded to support facilities administration. So what that means is for a grant that receives that 54% rate, 35% of the total grant dollars awarded for that grant, 35% are sourced to facilities administration, or the so-called indirect costs. When you look at all of our NIH portfolio at the University of Minnesota, because not all grants receive that 54%, some receive less for a variety of reasons because of how those grants are categorized. In those cases, when we look at the aggregate of our grant pool, 27% of the total grant dollars that were awarded in fiscal year 24 were planned for sourcing to indirect costs. So that means 73% are going to the directly budgeted activities of the grant. So I wanted to take a moment to provide that degree of contextualization of the sort of essential nature, the quite essential nature of facilities and administration, and how it works in terms of these percentage breakdowns. A cut to 15% would be absolutely devastating. Because you can imagine, for example, for our regulatory compliance or the generation of materials, including, for example, immune cell-based therapies for clinical trials. These activities require the very highest degrees of quality control and scrupulousness. There is no halfway. There is no, if we reduce, then we'll have to make do. What this will mean if we are to see a 15% facilities administration rate is much would have to be sacrificed. Many of the studies simply could not be done because there isn't a halfway with these activities. So that's the content that I have, but it would be my privilege to answer questions from this group today.
Well, thank you. Thank you, Dr. Crawford. And the questions are rolling in, and that was a really great explanation about the indirect costs. Yeah, you were starting to talk about if that rate changed, and that some indirect costs and F&A funding is at 54%. Other grants are at different rates. And it sounds like there's different categories. Can you talk a little bit about that and explain that to us a bit more? Because people are throwing around different numbers. Well, we could put it at 34%. We could put it at this percent. And I'm just wondering what the thinking behind how those are calculated is created.
Yes. So each institution will negotiate what its rate is with the Department of Health and Human Services. And this will have a varying duration, and there'll be a negotiated rate that is related to the type of study, where the work is being done, the kind of work that is being performed, and other factors that are institution specific. It all goes into a formula that is ultimately negotiated between the university. So there's a single university level standard that is set for a given type of study. So for many research grants, that number is at the University of Minnesota is 54% for organized research that is performed on campus. Other sponsored activities might have a lower rate. Clinical trials, for example, have a lower rate that's in the 20s or 30s. Work that's performed off campus but is sponsored by the University of Minnesota has an individually negotiated rate that is lower. Training grants. So these are very important grants that support the training programs, the tuition and stipends for research trainees. these kind or career development awards for people who are heading into an independent phase of their research career, these types of grants have lower F&A rates, as low as 8%. So it really just depends, and that is the reason why different grant awards will be eligible for different F&A recovery, which is why we don't receive 54% for all grants that we receive.
That's a very helpful explanation. Thank you. You mentioned the idea of NIH funding as an issue of national security. Can you expand on that a bit?
Yeah, I think it's really important because there's multiple ways I think in which this is germane. I think of it, from readily identifiable components. For example, our data security, right? So our data security requires sophisticated infrastructure in terms of hardware and servers and software, of course. But we also need incredibly talented individuals to design and maintain those systems. So we need these incredibly important, talented, thoughtful individuals to be in place. If we're to be faced with a decreasing facilities administration rate, obviously we will always be the very best possible stewards that we possibly can be for all of our data. And I speak obviously in the context of the University of Minnesota, but really all of our institutions of higher learning in the United States. We need to ensure that we have a firewall, a firewall in every sense that protects those data from intrusions, from threats around the world that may not be friendly to us. So the data protection piece, I think, is one key example where this is going to be relevant. Where I think it also is relevant in terms of the national security scope is that, remember, that competitive edge that we have. We're way out ahead of really anyone else in the world. We're a vanguard in this capacity. I think our ability to ensure that we are keeping the best minds, the greatest thought leaders in the United States, because this investment is being made into this kind of work. This is also a central component of ensuring that we are delivering the very best development that is done in the very best way possible. If we were to recoil from that responsibility, we begin to cede some of these key components to other places in the world, not all of whom may have the United States interests at the top of their interests. So I think it's very important to put this moment where we are now in great context, and why in many ways this is a great challenge that we face today because of what we're seeing very clearly as a threat to federally sponsored research in the United States. We also have to take advantage of this opportunity to engage together, to learn from each other, frankly, for us to receive feedback as well from groups like this today in the Alumni Association, but also engage with our federal legislators so that we have this opportunity to ensure that they understand what we do, how we do it, that we take being accountable for what we do very seriously. And we're very grateful to our federal legislators and representatives at all levels in participating and leading with us in this process.
That was really helpful. Thank you. Question about how the university would prepare and respond if NIH funding was actually cut and there was a change to the F&A rates. What would happen to the University of Minnesota? People are curious about what happened to staff, students, researchers, research labs, the trials and the research going on. What would that look like?
Indeed, this is really important, and this has, really since the end of January, helped reshape a lot of what we do in the dean's office of the medical school, what we do, really across colleges. Although these new events are a set of challenges for us, there's so many opportunities that have emerged, and we partner and we certainly have always partnered with our intercollegiate colleagues across the institution, but we do so now in new ways. I like to think of it as really a a set of fundamental principles that we need to adhere to. So first and foremost, defend. Defend the existing programs to the very best of our ability, to work with our partners in the Sponsored Projects Administration Office and the Central University leadership to engage thoughtfully with our sponsors, to engage with our federal leaders, to ensure that as much as possible is preserved. And that's really important. And it's really incumbent on us. It's our responsibility to ensure that all stakeholders understand what is at stake here. Vulnerable communities, vulnerable patients, patients who've really extended past the standard of care, where a new standard of care needs to be defined. So this is that defend component. Engaging. What we're doing today is the second central tenet. Ensuring that we're having opportunities to have dialogues and for us to share with you what we do, why we do it, and then to hear ideas on how we might need to look at what we can do better. And that's really important, that stakeholder engagement across the Alumni Association today, as well as our citizens more broadly. And then with respect to the specifics of this really important and challenging question is the modeling and trying to understand where we will need to go and what we will need to do. So to me, I think it's incredibly important that our most impactful programs are preserved to the very best extent possible. So we need to ensure we're continuing to serve the most vulnerable, the sickest of the sick, the communities who need us most. I think that's absolutely critical. I think it's also critical that we don't sacrifice, that we ensure that we're doing everything possible to preserve the development of the next generation. It's really important that we preserve as many jobs as we can, that we're not faced with the impossible decisions of having to cut jobs. These are things that we don't like to think about, but obviously if we're going to be faced with funding cuts of the level that we could be faced with, we do have to face those realities, but we're doing everything we can to preserve every single job that we can. But the next generation is also something that we cannot possibly sacrifice, because even if we were forced to lose something in this generation, which is not something that we will ever easily accept, we certainly can't afford to lose the next generation. So what we're doing with the modeling piece is doing everything we can to understand where those points of vulnerability are today. We're engaging with all of our investigators through all of our administrative units to understand where the vulnerable components of our research infrastructure are today, so that we can do everything we can, sometimes financial, sometimes it might be logistical, it might be banding together, it might be converging initiatives in a way that renders more efficient cost saving measures that nonetheless allow for those programs to continue. So we're doing so in a strategic way as we can, to understand where the impact is being felt today, while also projecting and understanding where we will be looking on the immediate horizon.
For those who may not be familiar with NIH funding and the research that you're doing, could you give just one or two real-world examples of maybe current research happening at the university that's NIH funded?
Yeah, I'd be delighted to. Thanks for the question. So a couple of great examples. I mean, there's so many, and I won't. I mean, I'm so proud of the people in my own research group and our collaborators and learners and developing faculty. I'll give a couple of examples outside of it that have direct implications on patients, for example. So, at the University of Minnesota, we're fortunate to have state-of-the-art immune cell-based therapies that are commonly applied for many cancers that are common but very difficult to treat, that have been not responsive to standard of care therapies, or rare cancers that still need definitions of those standards of care. So these immune cell-based therapies require highly controlled manufacturing environments that are called good manufacturing practice facilities, that ensure the highest degree of fidelity in product safety and efficacy. So the facilities that are required must comply with Food and Drug Administration policies and practices. This requires clean rooms, rigorous quality control, incredibly well-trained and talented people that will enable the development of these, and then obviously integration across, into our health system in a way that we can ensure that the integration of our products that ultimately can be realized for the delivery of new care modalities. So that's one example. Another example that I'd like to cite is our world-class magnetic resonance imaging at the University of Minnesota. So we have a world-class Center for Magnetic Resonance Research. It has some of the most state-of-the-art equipment, but also the most incredible talent in the world, I would say, at developing new modalities for what's called ultra-high field magnetic resonance imaging. Acquiring images, particularly of the brain, but really any location in the body. But we have incredibly accomplished investigators in the nervous system that are helping us understand at the most granular levels the anatomical features that help define behavioral disorders, mood disorders like depression, disorders that are neurodegenerative like Alzheimer's disease, as well as addiction disorders. And it's this level of insight and partnership that the Center for Magnetic Resonance Research enables that really makes a difference in people's lives. And we're fortunate to have this incredible group of talented individuals. The technology that they use, there's no mistaking. It is expensive, but when something is of the level of impact and the needle-moving nature of the work that they do, the investment is very much worth it and generates a great return. So those are a couple of examples of the phenomenal investigation that is NIH funded at the University of Minnesota.
Oh, so helpful. Thank you. So one of our listeners asked if they happen to be sitting next to their congressperson on their next flight to DC, what are 2 or 3 short things that they should tell them about the impact of NIH cuts?
Yeah, what a wonderful question. Because in these moments, we always have to think about what is the best way to deliver the most high impact message as efficiently as possible. And I really do come back to this notion of really, it defines our character and who we are when we look at what we invest in federally sponsored research, how we lead the world in this regard, and how it underpins that bond of trust that I mentioned earlier that connects our citizens through the federal government to our health systems, to our private foundations, to our for-profit private sector, that really spans that spectrum from discovery through translation, through commercialization in a manner that really there's no other place in the world that does it as well as we do. Acknowledging that obviously there's opportunities for improvement, there's opportunities for feedback, for self-reflection, but we really do it in a way and to a level of impact that nowhere else in the world does. We don't want to lose that competitive edge. We are a standard setter. We don't want to lose our best minds to other nations, and the risk of that is it's real. If we were to dramatically curtail our society's investment in healthcare research, we would most certainly be at risk of losing some of our best minds. So this is of great importance. This is part of our national identity. And this is something that we simply can't forgo. And I obviously would be grateful to and have been grateful. In fact, I was so grateful to Senators Klobuchar and Smith who visited us on February 14th to relay this exact message.
Great. So there's a number of questions about what role industry partnerships and private philanthropy or alternate funding sources could play in mitigating the impacts of NIH cuts. Could those replace NIH funding?
Also a phenomenal question. This is a time where we definitely want to engage with our philanthropic partners. We always do, of course, but perhaps now is sort of a new and refreshed opportunity to engage those conversations. I wouldn't say that we would entirely rely or replace the $40 billion plus a year that the National Institutes of Health invests. But this is a time to ensure that the public, as well as our benefactor partners, have an understanding in their critical role in this context. And I'm really glad that the question was asked. I'm grateful to our partners in the University of Minnesota Foundation. These leaders have they instantaneously recognized the importance of this moment. This is a moment of challenge that we can't shy away from. And we have partnered with them in new ways. We obviously already partner with UMF, but in new ways to help reimagine the landscape and understand the special moment that we're in right now. The role of industry is really important to underscore. I am really excited about the partnerships that we have with the private sector, and we do need to continue to build those and grow those. For us to be the most effective partners possible for the private sector that do have very real need to have a profit oriented component to what they do, I would say we need to continue to invest wisely together, continue to generate those partnerships. And I'm so grateful to our partners that are reflected in that sort of consortium, that federation of wonderful companies, whether they're the multinational large corporations or the smaller biotechs through the Medical Alley Consortium. It's a wonderful opportunity for us. But that bond of trust that I mentioned, it's absolutely critical that we do have a publicly funded component to what we do, because the discovery and early translation components are very commonly not profit generating by design, because we do have to invest and fail. We have to fail efficiently, but we do have to fail because we need to see where we need to go after we have failed. Those components sometimes frequently are not profit generating. So we do need that publicly supported component, but we do need to be very tuned in to translating and moving into the commercialization mindset as quickly as possible. And our private sector partners understand that very well.
You showed us a slide earlier about the U.S. position in the world in terms of investment and funding research. There are a couple of questions on China and where China sits and how that looks compared to the United States.
It's an important question that I don't have the quantitative answer to, and I should, and I need to get that number. But what I can tell you on that score is that this is a bit anecdotal, but it is real. The presence of research that is done in China that is being represented in the body of literature that is predominantly historically dominated by the United States. The share of that that is represented by work done in China has markedly increased in the last year to 2 years. So that is something that I don't have the quantitative data on today, but it is really important because it's a bit of a leading indicator. Because if it was already happening before these projected cuts that the Health and Human Services Department has put forth, and the NIH itself has put forth. The NIH is one of the agencies within Health and Human Services, of course. Then that incorporation of Chinese research into the body of research that is represented of the very best work worldwide will only increase. And I would say it will increase exponentially. So that is that competitive edge that I was mentioning earlier. And I apologize, I don't have the quantitative data. They may not be as easy to acquire, of course, in terms of the investment of the Chinese government into their research, although it is possible that those data are there. Important question.
Yeah, and you noted that, right, that competitive edge relates to national security. It relates to retaining talent, the best talent in the United States, and then obviously the life-saving research that happens right here that spins off into companies and intellectual property that stays here in the U.S. and then expands around the world. So yeah, thank you for that answer. There's a question about state government and the role that the state plays in research funding. How does the state's budget support the U of M's research enterprise?
We're so grateful to the citizens of the state of Minnesota. I always like to say, we're incredibly proud of the manner in which we lead the nation by how we serve Minnesotans here at the University of Minnesota, obviously our land grant institution. We are so grateful to the citizens of Minnesota, to our state government. I've had the privilege of testifying 3 times in the state capitol just this year alone as they undertake their budget planning and proceeding. We are very fortunate to receive funding from the state, and I'm really glad this question was asked because it's a critical component of infrastructure for us. We have a number of really exciting, important, impactful programs here at the University of Minnesota Medical School in particular that are directly funded by the state. Our medical discovery teams that are incredible world-leading experts, for example, in the biology of aging and metabolism, of imaging in the nervous system, of caring for those in communities, in our rural communities, particularly our indigenous communities, and dementia care in our indigenous communities, as well as addiction, the biology of addiction, as well as the community-based impact of addiction. So these are examples of programs for which we're incredibly grateful to the state for directly funding our medical discovery teams. In addition, I'd like to highlight some grant programs that we have that are reflected through partnerships that we have with the Mayo Clinic that are joint funded partnerships that are supported by the state of Minnesota, our state government. And these grant programs are also spanning what we kind of call the translational spectrum from early phase discovery all the way through early commercialization components. So that Minnesota state funded partnership and another partnership called the Regenerative Medicine Minnesota program, all funded directly through the state of Minnesota. So it's been a privilege for me to testify for our both state House legislature as well as the Senate to describe the successes and the impact quite directly of these programs that we're so grateful for from the state.
So we're benefiting from both state and federal research.
Absolutely.
Yeah, absolutely. Has the U of M seen any projects canceled or paused at this point from the federal executive orders coming down?
Yes, we have. Our partners in the Sponsored Projects Administration Office are very assiduously collecting those data and then obviously doing everything possible to engage with our appropriate units to provide opportunities to appeal those decisions. But a couple dozen contracts have received stop work orders at the University of Minnesota, more broadly speaking. And it's a very actively evolving set of circumstances, each with respect to each given award that received that stop work order notice from the federal agency, as well as trying to do everything we can to do everything possible to preserve those programs and all of our programs here at the University of Minnesota.
And there's a robust website that the university maintains that outlines all of that. So I'll ask our staff to put that in the chat so everybody can read in detail on exactly what's happening, kind of up to a weekly update on that for sure.
And one other thing I'll note, sorry to cut you off, Lisa, but real quick. So my office is in daily communication with the Sponsored Projects Administration Office and the Research Innovation Office, which into which the SPA office reports. We are literally in daily communication, frequently multiple times a day as we work through this.
Right. Um, can you just, this is the last question, but can you talk a little bit more about, uh, if NIH cuts happened, what would happen to our students, our medical students, our graduate students, the teaching at the university, kind of explaining the research impact on teaching and what would happen to our future healthcare workforce?
I can't underscore enough our commitment to support and defend, quite honestly, our current employees, our current learners, and the next generation that emanates from this incredible wealth of talent and energy in those that are in learning phases. Um, we are committed to do everything possible to preserve our programs. I'm sure that many in this audience have read that other programs, for example, that are training graduate students, PhD students around the country, have either temporarily or even for the year paused their programs. We have not paused our programs in the medical school at the University of Minnesota. We have phenomenal, over 450 PhD students do their graduate training at the University of Minnesota Medical School. We have not paused our program. We are taking a cautious approach because we understand that if other programs around the country have rolled back their admissions, that might yield a higher matriculation rate than unfortunately we would be able to accommodate. So we're proceeding cautiously, but we have not paused our graduate admissions. With regard to our medical students, those that are training to be physicians, I want to underscore that, that 70% of our healthcare professionals in the state of Minnesota have trained at some point at the University of Minnesota. We are going to do everything possible to ensure that that remains there and even higher, of course. So we are faithfully committed to ensure that we're doing everything possible to continue to train the next generation of healthcare professionals and practitioners for the state of Minnesota here at the University of Minnesota. So this is incredibly important, and we will continue to defend that. My partner in undergraduate medical education, Associate Dean Jeff Chipman, is completely committed to maintaining our medical student training ranks. And then our postgraduate training ranks, of course, incredibly committed, the residencies and fellowships, of course. But our scientific training core, we are very committed to doing everything possible to preserving. But yes, we're needing to actively look at this because of what other institutions might be doing.
Right. Yeah. And we very much want to train those next generation of healthcare providers who are going to take care of all of us. So we appreciate that. There is one question that has popped up that I do think is a really important one. And that's, how are you working together with other universities or, other associations, higher education industry, to advocate for the growth of NIH funding rather than the cut of it?
Absolutely. There are a number of consortia or federations of universities. A couple that we're very closely involved with are the Association of American Universities, or AAU, the American Public Land Grant Universities, or APLU. These are a couple of examples of consortia that we're very closely tied with. In fact, the initial set of legal actions that were taken against the FNA cut by the NIH of 15%. University of Minnesota was very much front and center in putting together the legal petitions that ultimately were, granted a temporary restraining order, then an extension of that restraining order, and then ultimately a preliminary injunction. I'm learning more about the legal process than I ever imagined, but it's part of the process. But there are multiple units that allow us to formally engage nationwide. The Association of American Colleges as well is another one that we engaged with in the AAMC, the Association of American Medical Colleges, is another one within the medical school that we engage with. So yes, we are locked in arms with our partners around the country to develop consortia, to develop shared practices and approaching, again, those central tenets of defending, engaging, and modeling, and obviously understanding how we can develop a path forward.
Right. Well, speaking of locking arms, there is a number of questions about how alumni can support the university and advocate on behalf of our research mission. So, what would be your ask of this audience?
I am so grateful for this question. First of all, your attendance today is really important. And you know, moments like this really do ask a lot of us. And I really believe with everything in me that these are remarkable challenges, but incredible opportunities as well. It's really important that we talk to our neighbors, our families, that we begin to sort of introduce, maybe for some, an opportunity to educate. But I'm always receptive to receiving feedback as well, and getting questions like I'm getting today to understand how we can think about what we do better. But it's important for us to get the message out, the things that I've talked about in terms of that bond of trust, that connectivity that really extends all the way, through our citizens, the federal government, and into the private sector and philanthropists and private foundations. That this is really part of I would say, our national identity. This is not something that we want to lose. We don't want to lose out to other nations around the world. So let's spread this word with our colleagues, our families, our neighbors, really important. And let's also get on as many airplanes next to our federal legislators as we can, to just to reference a question that was raised earlier, and have that maybe 60-second elevator pitch to really underscore that this is our moment. This is a moment that we don't want to lose this opportunity. Continue to get that message out there, of course. And then, of course, when we think about some of the engagements as was raised in an earlier question about engagement with our prospective benefactors, this is also a very important moment. We want to hear from those prospective philanthropists, and really any citizen, what's important to them. How can we serve Minnesotans better?
Well, Dr. Crawford, this has been such an informative and inspirational time with you. And there are 633,000 alumni around the world. So imagine if we all raised our voice and had those conversations, the power of what we can do. So we're so grateful that you have been here to talk to us today. And I'm now going to hand it over to Sam Rosemark, who is our Director of Alumni Advocacy, to talk to you a little bit, all the participants, about what they can do to make a difference on behalf of the U related to federal research.
Thank you all.
Thank you so much, Lisa. Thank you, Dr. Crawford, for the really inspiring and informational session. So advocacy is core to the mission of the Alumni Association. We work to protect and strengthen the value of your degree. When I think of advocacy, I often think of it as a large crowd coming together and singing the Minnesota Rouser, and in particular, the line, "Firm and strong, united are we." Alumni coming together in a chorus of voices can have a profound impact on our elected officials and the U of M. Now is the time to take quick and effective action on our next slide, and to push the protection of research funding across the goal line. We have more than 500 people on today's call. If each of us take this action, we will make a huge impact on Congress. To take action, simply scan the QR code or navigate to the link to fill out your form and take action. The link will also be added to the chat that you can easily click. A member of our team will drop that in. From the website, you'll find a simple form for you to type your message to your U.S. representative and your U.S. senator. To help, we have provided a prompt that you can tweak and personalize. Once you click send, we'll take it from there for you. Your story and your voice matters and is highly effective. A personal story is 22 times more effective than a fact alone. As a constituent, your member of Congress wants to hear from you and prioritizes your messages. As an alum, you are an example of the U of M's impact, and together, alumni have a powerful voice across the country. In fact, there are more than 570,000 U of M system alumni in the United States. Sharing how the U of M has impacted your life is your story. The U of M impacts us in so many ways. Each of you have your own unique and powerful story to share. Whether you receive life-saving care from the U of M or you're using your U of M degree to power your local workforce. Or maybe the reason you moved to Minnesota is because you attended the U of M for its great education and are now giving back to the state. The U of M has given us groundbreaking discoveries we use each and every day, like the seatbelt. If you have yet to take action to share your story, go ahead and scan that QR code and navigate to the link to add to the many, many voices here today supporting the U of M. I'm going to pause for just a moment here and let you all do that. With over 500 people on the call, we can really make an impact with our members of Congress. So in closing, this concludes our webinar, and I want to really again thank Dr. Crawford and all of you who joined us today for this really great session. We will share the recording along with a summary of action steps that you can take via email, and it will also be posted to the Alumni Association website, the link that you just navigated to. Please consider sharing this informational webinar with your family and friends. It's very much encouraged. And we hope you have a nice rest of your day. Thank you all very much and take good care.